Hello, good morning. I'm Dr. Asha Pherwani from a consultant in Hinduja Hospital. I'm a specialist in pediatrics, especially pediatrics and adults allergy and asthma. Today's topic is allergy and asthma. I'll first give you a small talk on what is allergy and then we'll have a question answer sessions. Now everybody thinks that asthma is just, allergy is just itching. Many times people come and say, oh, I've got allergy. They don't specify what allergy they have got. So we are to ask them, what is it? Do you get skin allergy? Are you having respiratory allergies? Are you having drug allergies? Because as we know, allergy is a multi-headed monster. It has many variations. You can have colds, you can have skin rashes, you can have contact dermatitis, you can have eczema, there can be asthma, there could be ocular allergies, allergies of the food pipe, insect allergies, sudden death and anaphylaxis due to food allergies, and reaction to the drugs. Now, since we know all this, we have to go. I'll tell you something about each of these things. Up to the 19th century, there were very few cases of allergic cold and none of any other allergies. They have been increasing rapidly since that time. First, it was thought that it's only increasing in the westernized countries. But now we know that the allergies are very rampant in India also, and we are losing a lot of school time, work time, lot of expenses on medicine. What is disturbing is the observation of new allergies, like allergies to nuts, soya, latex, gelatin. The other day, a patient came to me and she said, Doctor, I'm allergic to almonds. I said, look, almonds are really not a very common allergen. It might be something else. She said, no, I'm allergic to almonds. So next time I asked her to come and she brought one piece of almond and I told her, now here you eat almond. She ate the almond. For 10 minutes she was okay and then suddenly she got a reaction. I had to resuscitate her. So we don't take any allergies very lightly. What is allergy? Allergy is a body reaction to an allergen. An allergen is a foreign substance. As soon as the substance enters his body, the body reacts. Now, from where can this allergen enter our body? It can enter from the eyes, from the nose, from the mouth, throat, from the respiratory tract, or from the food pipe, or even the skin. Now, these are the points of entry of the allergen. The body is made in such a way that these allergens are reacted to, they have a reaction with our body's immune system. Now, if the body can really get rid of this allergen, it is immunity. Here you see it has been taken care of, and over if you cannot take care of it, it is called allergy. A response that causes harm to the body. Why? Because wherever the allergen enters the body, there are body's defense mechanisms, like there are immune cells underneath the skin, in the eye, in the nose, and these react with the allergens. Initially, what these immune cells do is gulp up these allergens and try to throw them out of the body. In the process, they also die sometimes, and this is taken care of. But if you have a genetic propensity, and if the allergen is very large in amount, this allergen goes to the body into a gland called the thymus, and there produces IgE antibodies. These IgE antibodies go and sit at these places where the allergens enter. And once the allergen comes next time, the IgE reacts with them and produces chemicals. And you can see here that chemicals are being produced over here in those areas. So what do these chemicals do? In the eyes, they will give redness, itching, watering. In the nose, they will give sneezing, they will give blocked nose, and they will give watering of the nose. In the throat, it will give irritation of the throat. In the nose, they will give sinusitis, watering nose, blocked nose that I told you. And in the skin, they will give urticaria. It could well be a drug allergy, an insect bite, or some chemicals like hair dyes that you use in your body. Now here, this is one thing which we all must know. This is how some of the allergies develop. Here is an infant. We have seen cases right from 2 to 3 months of age coming with red rashes, especially on the cheeks, on the creases, the elbows, the creases of the legs. And these rashes are not so very dangerous to life. But what happens is this is a signal that these children are of a very allergic nature. Because they predispose, they give us a warning that this is an allergic child. And as he grows, he might come with food pipe allergies, respiratory allergies, or even progress to asthma. So it is at this stage we have to be very careful and do something for them. This is called the allergic march. You can see the allergic march here. So here you see the food allergies. After that food allergies go down, then you get the respiratory allergies, skin allergies and everything. And this person is more likely to get the involvement of the respiratory tract and asthma. Now, this is one thing. So many people are so frightened of this. They say if I put my arm on the desk, I get rashes. I scratch, I get things like this. But don't be afraid of this because this is only a sign that you are allergic. It's not going to harm you. In a food allergy, you will see tongue like this, coated tongue like this. If you see a face like this, you know this child has nasal allergies. Look at the mouth which is open because the nose is blocked, the child has to breathe from the mouth. Because of sinuses being full here, the child has all these bags over here. There will be watering, redness of the eyes, sneezing, nose blocked, the child will be snoring probably at night. So these respiratory allergies are a very, very common problem in, I would say, all over the world. And you can see, this is twitching of nose. It is irritation of the nose. This child is trying to open the nose airway because it's blocked by doing this. This is called the allergic salute. And by doing repeatedly this allergic salute, the child will get a crease over here. And you can see here polyps. These occur when the allergies in the nose remain for a very long time. And sinusitis. This is whenever the child has so many chronic nose involvement, you must always take an X-ray of the sinus to see if the sinus is involved. Here you can see that this sinus is full of inflammation. And you have to treat the sinus, otherwise your treatment will not have any effect. Then there are these eye allergies. You can see lid allergy, another eye drops allergy, on the lid allergy, and involvement of the actual eye. Now so many people go on putting eye drops, cortisone eye drops in this. And this is what you get, tubular vision. Your side vision goes away and you get a tubular vision. So always find the cause, treat not with steroids but with anti-allergic drugs. And also because of venous congestion, the muscles of the mouth become very strong and you get, all these buck teeth and shape in face. The shape of the face gets distorted. Here I would like to show you, this is drug allergy to methotrexate. This was my first case of drug allergy, insulin, allergy to insulin. Here we have a skin rashes. This is pressure urticaria. This is urticaria to tannin in the leather. Same here. And this is allergy to artificial ornaments. Here you have this and you can see all rashes around the ear. Now this insect allergy. This is what is the house dust mite. This is present in our bed mattresses, pillows, carpets and curtains. And these are there in millions. You cannot see them, but they are bedbug-like creatures which are present in the cotton dust of the mattress. So we know we give cotton dust and house dust mite prevention to these people. Another common insect is the cockroach. You have to keep your house in, arrange your house in such a way that there are no cracks and broken walls or something, damp walls where all these insects grow. This is the latex allergy. Nurses, doctors, everybody wearing gloves can get it. And this is the pigeon. Now what's pigeon doing here? The pigeon sits outside your house. He will sit on the AC. He will sit on the parapet and he will also shit there. All this get dried and the feathers get dried and they are blown inside your house. And this is a very common cause of allergy. We had a nurse who was suffering perennially from pigeon allergy and there were pigeons on our windows. When we closed them, she was much better without any other treatment. Now these are grasses. I don't know whether you can see, but this is Congress grass. It's the most common grass pollen causing allergies in Pune, in Bombay, in Bangalore and so many. It grows into wilderness. And this is the common grasses. These common grasses also can cause severe allergies. Now these pollens can travel uh, a distance of 5 to 10 kilometers from the place where they are growing. So you can't say, oh, but there are no these cynodons near our house. How can we get allergy? Nothing like that. Another big problem is food allergy. Let me only tell you that those can be to immune reaction to foods or other causes. We will not go into great this thing. The most common food allergies are, in food allergies, it's not necessary to get only symptoms of the gastrointestinal tract. You can also get systemic reactions. As I told you, that almond was caused a systemic reaction where the patient fainted. So, but the general symptoms can be itching, tingling around the mouth, swelling of the lips, tongue and throat involvement, nausea, vomiting, diarrhea, abdominal pain, and other symptoms. Most common allergic foods in infancy: milk and milk products, and 30% of these are also people are also allergic to soya. Wheat is an increasingly common food that is gaining importance in Asia. Egg allergy is also common. Peanut allergy is more common abroad than here. And tree nuts, here we have seen very little of tree nuts allergies. Fish and shellfish and all these are very common, and it is very difficult to cause tolerization to these fish and shellfishes and seafood. Then you have the pets allergy. There was a baby who was suffering so much from a dog at home. And we asked her, what should we do? We remove the baby or the dog? She said, remove the baby. because they are so fond of it that it's becoming very difficult to treat such children. However, even if you remove the pet from the house, for 1 year, its pollens, its allergens are still around in the house. Now, another thing. Now suppose you are traveling, somebody has a reaction to a peanut, anaphylaxis. If nothing is done, he might die. But the patient might be carrying with him something like this. This is an adrenaline injection, or anywhere else where there is a reaction, you must keep it, and you can just take it open without sterilizing any area. Just push it inside the muscle or any part of the body. First half, and then second after 15 minutes if necessary, another half. Very interesting thing is that the mother during pregnancy has a allergic type of immune environment in the body that is called Th2 environment. And so the infant is also got that type of immunity. When the infant is born, gradually it turns to the Th1 type, which is the immune type of reaction. And this only comes when the child faces so many respiratory infections, like he gets cold, cough, and all. So just don't jump to antibiotics. Cold, just give symptomatic treatment and be happy that your child is getting these small little infections, because they are giving immunity to your child. This is how we do the skin allergy testing. Here is the skin allergy testing. This is the patch test for contact dermatitis. These are the reactions to be seen. These are the common plants that we have got. There is something called ice allergy. This is just for your information. We had 2 cases. And this is esterase inhibitor deficiency, in which one enzyme is deficient, and we had around 4 people in the family die of this. I think now we are ready for, but this is what is asthma, and I will answer your questions on asthma as and when you ask them. Okay. Your question is it something not working in the body? It's actually, the theory goes that you are either allergic, you have a propensity to be allergic or not. Are you allergic or not? Now this depends upon whether you have that gene in your body which your parents have. That means if your father, mother or brother all have asthma, then you have a stronger gene and you would have more asthma. If somebody has allergic rhinitis, you are more likely to have allergic rhinitis. So you have a particular gene. And when, as you grow, when you come in contact with the world, with different allergens, and if you are allergic to that allergen, then you would get the symptoms of allergy. Now, how you are allergic to a certain allergen, how you get, it's a big theory, but when the allergen enters into the body, as I told you, the body cells under the skin carry, there are Langerhans cells which carry this allergic material to the thymus. In the thymus, this material is dissected sort of, uh, all the proteins are dissected and they are sent through our HLA system, and this are IgE is produced in the body against all these allergens. And this IgE can recognize the principal allergen which is attacking the body. Suppose you have got IgE, specific IgE against an almond, then whenever almond comes in the food, now this is the IgE which is produced when your allergen goes from the periphery to the skin, to the nose, goes to the thymus, where thymus produces IgE if you are from an allergic family. And then this IgE will go back and sit at areas from which the allergens will enter. And when next time the same allergen enters, the specific allergen enters, this IgE will react with it and produce the chemicals which cause symptoms of allergy. Now you can give up these allergies, you can produce allergies more against these. So you will say some of them don't get their allergies even though if they have IgE because they have not come in contact with that allergen. You have to come in contact with that allergen one time, then the body will recognize it next time when it comes and react. Is that, have I answered your question? Nowadays, we have got various methods of testing allergies, but the old standard method of diagnosis and allergy still remains the skin prick test. This was the skin prick test which first Noon rubbed on his body and pricked himself and showed that he is allergic to grass pollen. Because we are giving a direct challenge to the body, and if the body is allergic to that substance, we will get the reaction. So this is 100% sensitive in the hands of an allergic person. On the other hand, now we have all these RAST and RIA. Now RAST and RIA have a sensitivity of only 50 to 60%. And in case you have over a period of time gained tolerance to a particular allergen, it will still show you positive. So there are many false positives with all these other blood tests. Yeah, so I'll give you just a general principle of how allergies are tested. So we take a first a complete history. We'll see if whether one organ is involved like the skin or skin and the rhinitis is there or rhinitis as asthma is there because you cannot treat only one organ. You have to see the whole body, how many things are involved. Then you do a skin test. In the skin test, you find out what are the allergens. Then depending on those tests, if suppose it is a food or something, you avoid those. If you have dust mites, you give treatment for dust mites. In such a way, we try to do this. But suppose you can do nothing. Now suppose there is a food, like milk for children. There is a food and the child is allergic to food. Nowadays they say that in the body, in the gut, there are some cells called the TR cells. These are the immune cells. And these cells, if you give them milk, say 1 drop today, 2 drops tomorrow, 4 afterwards, and go on gradually giving milk, they will be able to tolerate milk. Similarly, for seafood also, they have been able to tolerate if given in this manner in which the body tolerates them. Now, medical treatment is another thing. Medical treatment is based mainly on antihistamines. Now, we have many types of antihistamines, first generation, second generation. The first generation antihistamines are, I find, a little more powerful, but they give rise to sleep and this is a side effect. So then you give second generation, which is the cetirizine, and you give an Allegra because it works for 24 hours, and cetirizine and others work only for 4 to 6 hours. Now, if you have a rhinitis patient who has not blocked nose and is very much distressed, his quality of life is being affected, then you can put in a Montelukast or Romilast or something at bedtime so that his sleep is restored. And not only that, these modifiers will also decrease the chances of polyps getting bigger and bigger. Now the next thing is, now suppose this was not non-asthma cases, you take an asthma cases. You have given him, you have done his allergy testing, you have taken his pulmonary function test, and now you want to give him treatment. So what you will do, you will try as many things as you can avoid. And then if there are some respiratory allergens, you can make oral vaccines for them. Oral vaccines are vaccines kept under the tongue. They need a little more contact with the mucosa of the tongue. So therefore you have to keep, suppose you are giving 2 drops under the tongue, you have to keep it for about 30 to 40 seconds and then tell them to swallow it. So this we gave around for 5 years. It is a first we give higher lower doses and then increase to higher doses and then give less frequent doses, and after 5 years probably some of them do not relapse, but others may relapse after 2 or 3 years, then you have to give again. But one thing is there, if you see a child with allergic march, vaccines are better because they prevent newer allergen sensitization and they delay the onset of asthma. I showed you that asthma can occur in these people who have this allergic march. Long-term reactions from having these skin, one is the quality of life suffers. Second, performance suffers because the nose is blocked, the person cannot sleep well. Third is all the time scratching, so he can't go into public places. We have our study on all these people with urticaria, asthma, rhinitis, and their quality of life. The quality of life is really very poor in these cases. And not only that, if you go to see if in asthma, you let that inflammation remain in the lungs. After all, what is asthma? It is inflammation of the airways. And that if it is not treated, then it will cause airway remodeling and the airways will become narrower and asthmas will become more. If you leave other allergies, I think one should not really leave them alone.